Hello, and welcome to today's webinar, Shockwave Therapy, a cutting-edge treatment for chronic foot, heel, and ankle pain. This webinar is presented by Zimmer MedizinSystems. I'm Regina West, and I'll be moderating the webinar today. During the presentation, you may submit questions by typing them in the Questions tab on your webinar control panel. Following today's presentation, we will cover those questions live. If there's not enough time remaining for all of the Q&A, answers to your questions will be emailed to you. I'd now like to give some background on today's speaker, Dr. Jay Spector. Dr. Jay Spector earned a doctorate in podiatric medicine from New York College of Podiatric Medicine and then completed the Georgia Podiatric Surgical Residency Program in 1994. He's been practicing in the Atlanta area for 25 years. Dr. Spector's undergraduate degree in economics provides him with a sound foundation for operating a successful practice. He's a podiatric surgeon at Atlanta Sports Podiatry, which he founded in 2018. With 2 locations in the Atlanta area, the practice specializes in treating athletic injuries of the feet and legs. His sports medicine practice utilizes traditional and alternative treatment methods like amniotic growth factors and shockwave therapy. Dr. Spector is a member of the AAPSM and is the current director of the Atlanta Running Institute. He's now conducting a phase 3 FDA study on injecting amniofix into the Achilles tendon. He's an accomplished speaker and author on various topics related to sports medicine. If you're just joining us, I'm about to introduce Dr. Jay Spector to speak on shockwave therapy, a cutting-edge treatment for chronic foot, heel, and ankle pain. Welcome again, everyone. Dr. Spector, thank you very much for being with us today.
Thank you.
I'll give you control of the presentation, and in a moment we should be able to see your screen. Just give me a moment.
Okay, I'm ready. There we go. Okay, guys, how are you doing? My name is Jay Spector, and I have a sports medicine practice in the Atlanta area, and I'm here to talk about radial shockwave therapy. It's good for your patients, great for your practice. What are some of the objectives? We're going to introduce the concept of radial shockwave therapy and explain how it'll benefit both your patients and your practice. Some of the indications for radial shockwave therapy are plantar fasciitis, Achilles tendinitis, retrocalcaneal bursitis, peroneal tendinitis, medial tibial stress syndrome, and wound care. In addition, I also treat iliotibial band syndrome, hamstring injuries, and posterior tibial tendinitis. Those are the common things that I treat. This is the N-Pulse handpiece, and you could see there's a blue cap on top. And I'll get back to the blue cap. By introduction, shock waves are sonic energy, because people will ask you, what is shock wave? It's energy. Extracorporeal shockwave therapy, or ESWT, the definition is the application of pressure mechanical waves outside the body, which is extracorporeal, that violently impact or shock biologic tissues for therapeutic purposes. ESWT high energy systems takes us back to the history of shockwave. In the late 80s brought about the introduction of other ESWT devices for the treatment of a variety of chronic conditions. In 2006, the United States FDA approved ESWT for the treatment of plantar fasciitis. And take a look at how big that machine is in the picture. What are some of the drawbacks to, the old high energy systems? Nerve blocks were needed. Sometimes people needed sedation. They were very painful. They took about 30 minutes. There was downtime for the patient. You sometimes needed a special room because of the size of the machine, and it often created scheduling issues. What are the advantages of the modern radial technology? Nerve blocks or anesthesia is not required. It usually takes about 5 minutes. Treatment is every 4 to 7 days. There's no downtime for the patient, with exceptions. Much more affordable for the practice and patients. And there's an average of 75 to 80% success rate. The reason why I went with Shockwave as a major modality for my practice is because all the evidence-based research that backs it up that says, you know what, this really works. The success rate, according to studies, is 75 to 80%. For certain treatments, I'm upwards of 85, 90%. But still, when you're telling your patients, you should tell them, what the research says, that it's 75 to 80% successful. What are the therapeutic effects of radial shockwave? Well, it creates a microtrauma or inflammatory response. It stimulates the expression of angiogenic growth factors and stimulates the ingrowth of neovascularization, actually creating new blood vessels around the area. It increases blood supply and it promotes tissue repair. Let's really look at these and see what's going on here. I think the main thing that's going on is the neovascularization, creating new blood vessels. And I tell patients that's what this is going to do, because they say, what is shockwave going to do? I also tell my patients, because we're creating an inflammatory response, that if they're going to embark on shockwave treatment, that they're not going to apply ice or take any NSAIDs, because we don't want to take inflammation away. We're kind of creating our own inflammation in the area by design. The neovascularization takes typically 6 to 10 weeks to happen. So if I'm treating a patient for, on average, 3 to 5 sessions, what happens is, for example, if I were to start treating a patient on a Friday, my typical protocol is I will treat them on Friday, have them come back on Wednesday, then the following Monday, then the following Friday. So if you look at that, within 14 days, they're getting 4 treatments in, 4 out of the typical 5. And because of this neovascularization, those blood vessels that are being formed around the area to allow it to heal may not form for 6 to 10 weeks. So I'll tell people it could take 6 to 10 weeks until you're completely better, but in a lot of cases, you're going to be better before that time. And everybody heals a little differently. So there's a biological mechanism that's going on here if you look down. So there are growth factors which are important in regulating a variety of cellular processes. Nociceptors. A nociceptor is a sensory receptor that responds to potentially damaging stimuli by sending nerve signals to the spinal cord and brain. This process, called nociception, usually causes the perception of pain. Radial shockwave therapy. All right, let's take a look at it. Can you see the video? You see the way the probe is on the skin, and you see that ripple effect. Okay, so a projectile is rapidly accelerated in the applicator, and the kinetic energy is transferred into the tissue in the form of a pressure wave. The shock wave continues to propagate in a radial fashion in the surrounding tissue. Now, my best way of visualizing what a radial fashion is, think of an ice cream cone. You have the bottom of the cone and the top of the cone. The top of the cone is the way radial waves are propagated. So think of them as spreading out like the top of an ice cream cone. So that's basically what happens. And if you're covering large areas, such as the Achilles tendon or If you're looking at medial tibial stress syndrome or shin splints, you have to cover, a shin could be more than a foot. So it's very nice having these waves spread out in a conical fashion to get a better delivery. What is the end pulse action? So the machine that we're talking about today is a radial shockwave machine called the Zimmer end pulse. And the end pulse action is that the shockwave is generated electromagnetically. The applicator produces kinetic energy that transfers the energy to the treatment area in the form of a pulse. What are the benefits of electromagnetic driven system? There's a slower rise in the peak of energy, which is more accommodating for the patient. It's more durable, and there's a longer warranty with less maintenance than air compressor systems. Okay. Introducing a cash model to your practice. We all know that reimbursements aren't what they used to be years ago. We have to work harder to make the same amount. And by incorporating a cash modality, we're going in a direction to offset the decrease in revenue. Getting into a little dollars and cents in terms of what I charge, I'm probably at the low end. I charge $485 for 3 to 5 sessions. This is how I present it to the patient. And some docs are charging $500, $600. I have a colleague who's out in California who charges $750, and patients are paying for this. Patients will pay out of pocket because guess what? They already are. Physical therapy, for example, is very long, inconvenient, and has expensive out-of-pocket copays. There's certainly a place for physical therapy. In our world, I refer to physical therapists, but look at the costs. The costs are typically $40 to $50 copays per visit. They typically go to a physical therapist 2 to 3 times a week for up to 6 weeks. So if you do the math, they're spending a lot of money. Deductibles are so high today that many patients never reach their yearly limit. I'm going to digress here and just throw in Obamacare. The reason why I'm throwing it in is a lot of us were sort of cursing Obamacare in the beginning, but I found out very early on that by most of the patients having high deductibles, it changed our sort of paradigm at checkout. I was always very envious of dentists because the basic certainly American population knew that when they went into a dentist practice that they were going to have to pay whatever it was charged. So if you got a filling and you had to pay $175 for that visit, you knew you had to pay it. You weren't relying on insurance to pay it. Now that people have high deductibles and high coinsurance, if our insurance provider allows $175 for today's visit, then that's what we have to collect if they haven't met their deductible. So patients are actually starting to get used to the fact that when they go to the doctor's office, they have to pay. The old analogy is when you go to a restaurant and your bill comes in, it's $80, you can't put in for that, and hope that in 30 days it'll get paid for. You're expected to pay it at the time of visit. Well, it's the same thing today in our practices. So when I have somebody come in, and I'm going to give you an example of plantar fasciitis. Plantar fasciitis is probably the most common thing that I treat on a daily basis. So a patient comes in, I do an exam, I go over their x-rays, and then we get the treatment options. My first option is not cortisone. My first option is shockwave. Why? Because of the efficacy. It works. As we discussed before, there are no needles. It takes 4 or 5 minutes for an entire treatment. They come in, either once a week or once every 4 to 7 days. And they have an instant analgesic effect. Right after they get off the table and they stand up, they definitely feel a difference in most cases. And this is very important, but I tell them it can take until the second, third, fourth, or fifth treatment before they have the sustained improvement. Let's switch over to Achilles tendinitis. So a patient comes in with either proximal, mid-body, or distal insertional Achilles tendinitis. Let's say it's mid-body and they have that fusiform swelling that we've all seen. And in the past, what were our treatment options? We'd send them to physical therapy, we'd put them in a boot. That's a very long and arduous process. And now that I certainly have shockwave, in my tool chest, I've noticed, and the patients certainly notice, that after the second or third treatment, we start to see that swelling go down. And in the case of plantar fasciitis, if an athlete says to me, "Doc, when could I start running again?" I tell them when it doesn't hurt when you're walking. When it doesn't hurt when you're walking, you could try running. In the case of Achilles tendinitis, it could take a little longer. It could take, till the second, third, or fourth visit. But I typically tell them that when they could walk downstairs and they don't have pain, then they could try running. And in most cases, that's usually the right time, because as we all know, walking downstairs is very painful for someone who has active Achilles tendinitis. Let me discuss medial tibial stress syndrome, or shin splints. I treat a lot of athletes, a lot of runners, high school athletes, and lots of them get shin splints. This could be due to weakness in their core and their glutes. Sometimes they need orthotics, but nonetheless, they come to me with a problem. And I'll give you a great example of my patient named Mary. Mary goes to private school, and for the past 2 years, she kept getting shin splints, and then that would lead to stress fractures. She couldn't get through an entire season without first the shin splint, then the stress fracture. And she happened to have been the fastest runner on her team. So she came to me by way of referral from one of the local running stores. And I said, let's try Shockwave. You certainly have nothing to lose. And I started her treatment on Monday, and I said, come back on Friday. She came back on Friday. She said, well, the pain's definitely less than it was. I said, okay, come back again in a week. She came back the next Friday. So she had 2 treatments. This was treatment number 3. She said that she was pain-free the rest of that week when she was running throughout the week. And Friday afternoon, she had a meet. And I said, okay, we're going to do the Shockwave now. She said, we're going to do the Shockwave the morning of my meet. When I have a meet this afternoon, I said, yes, absolutely, because you haven't really experienced any pain. So I did Shockwave number 3 on her. She ran that day. I got texts from her and her dad, how happy she was, how happy they were, because number 1, she didn't have any pain. Number 2, she set a PR, her personal record. And since then, she's now broken 21 minutes, which was her goal. And she had a 5K time of 20:25, and she's fielding some scholarships. So, this is a happy camper, and I'm treating some other athletes with similar scenarios. So I don't have any problem treating someone and then having them play whatever sport they're going to play. I play softball, and in the summer, I had my third baseman who came in with, a terrible Achilles tendon. The guy could barely walk, let alone run. And after 2 treatments, it was the same thing. I'm feeling a lot better. The swelling's down a lot. So I said, I want you to come in Sunday morning, 9 o'clock. I'm going to shockwave you. The game was at noon. Gave him the shockwave treatment. He ran the bases. He played great. And he was a very, very happy camper. So this is very gratifying. And this has become a big part of my practice. Okay, let me go on here. So my patients complain about their copays, but yet they drive nice cars and have no problem going to the mall for a nice bag. Patients are consumers, and consumers will always pay for what they want. Patients want quick, effective, and most important, convenience. Patients will always pay for convenience. Some patients don't want steroid injections. Patients will also exhaust all options for surgery. And you have to really present this to them. I've used steroids in the past. I used to use it for plantar fasciitis until I sort of saw the light and realized that the steroid injections weren't always getting people better. They get them better temporarily, and then a month later they'd be back complaining. And I don't want that. It makes me look bad, and my patients aren't happy. And if my patients are happy, I'm going to be happy, and everyone's going to be happy all around. So this is why, after probably about a year of hearing my colleagues talk about shockwave therapy, I finally took the plunge myself. And for example, today was a slow day. Today I only had 2 shockwave patients. My typical is between 4 and 9 patients a day, 5 days a week. And I've only been using it for about a year and 3 months. So, it builds up very, very quickly. And I'm very passionate about things that work. I'm all about efficacy. So again, when things work well, patients tell other patients, and they go back and tell their doctors, and they give you Google reviews, and it just simply helps your practice. I now have lettering on the window of my office because I'm in a shopping center. I'm sandwiched in between a running store and a CrossFit gym. And I have right on my window, that we offer shockwave therapy. And people will seek me out because of that, because they don't want injections, or they've had injections. They've had other modalities. I've had patients come to me who've been in boots for 4 months, and they come out of the boot and they're still hurting. So let me just move on. All you have to do is ask. Don't be afraid to bring it up to your patient, because if you really know something works, present it to them. Tell them, this is a modality where you don't need an injection. It takes 5 minutes. We can most of the time get you better in 3 to 5 treatments. I give my patients, if I have to, I give them 6 or 7 treatments. I kind of don't cap it, but it's really rare. Maybe on 3 patients have I ever had to go to 7 treatments. I don't charge them any more for it, because to me that's kind of nickel and diming, but that's totally up to you to decide what you want to do for them. But you make these people happy, and boy, seeing that smile on their face really goes a long way. So as you could see, the N-Pulse family, I'm not that familiar with the newest one, which is the one on the left. I have the N-Pulse Pro, which is the one on the right. It moves very easily. It's very presentable to the patients. It has a very nice interface. It's very professional looking. And another thing, and I wanted to bring this up so that you could see what the machine looks like. There are some injuries where people will say, you know what, sitting in the chair here, I can't pinpoint it exactly. So what do I have them do? I have them stand up. I said, recreate the position where you feel the pain. So I have them do that. And, you know, sometimes this is with a condition such as medial tibial stress syndrome or with a hamstring pain. I'll have them move in such a way where they're like, okay, there it is. There's the pain. So I say, don't move. I bring the machine over to them. I roll it over and I say, stand up. I'm going to do the treatment with you standing. And guess what? You could do this. It's a dynamic type thing. You could do it with them standing up. There's no rule that says that they have to be lying down. Okay. The end pulse systems, there are energy levels from 60 to 185 millijoules, adjustable in 10 millijoule increments, frequencies from 1 to 22. These the salespeople can tell you. Let me move on. And I just want to say thank you very much. And I'm here to answer any questions. The rep will supply my email address and ways to contact me. I'm available, and I'd be more than happy to further share any experiences with you and anything related to using Shockwave. I'm very, very accessible. Thank you.
Thank you so much for that presentation, Dr. Spector. I will take the screen back and give me just one moment. Okay, so now we're ready to begin the question and answer segment of our webinar. And you have a lot of questions rolling in here. And to the attendees, I just want to let you know, it's never too late. Keep those questions coming. And even if we don't have time to get to all of them, we will answer them via email. So let's get to the first question here. Dr. Spector, do you see success in treating retrocalcaneal bursitis with N-Pulse Pro?
Yes. Yeah, I wanted to circle back, actually. I had mentioned, and if you can go back to the previous slide.
Sure. This one?
For me. Yes, you see the blue cap on the applicator? So that blue cap, if you go near a bony prominence, you'll still get the shock wave, but the patient won't feel pain. Typically, I try to stay in soft tissue areas without the blue cap, because otherwise it could be painful if you hit a bone, because it's the nature of a shock wave. But if you have that blue cap on there, you could go distal insertional Achilles tendon. So the answer is yes.
Okay, great. Next question. Are steroid injections used in combination with this treatment?
Some people might. I don't. I haven't found the need to. So as I said, it's kind of counterintuitive to me, because we're trying to create an inflammatory response, not an anti-inflammatory response, which is what a steroid would do.
Okay, with shockwave for plantar fasciitis, are we causing neuropathy of nerve structure that leads to the relief?
Not that I know of. I haven't seen any neuropathy. As a matter of fact, I haven't seen any side effects. One time when I was using the shockwave on a hamstring, there was a little black and blue afterwards, but that's the only side effect that I've ever seen, and it was just once. You see, there you could see in this picture, you could see with the blue cap on, not quite insertional, but getting close. But you can go closer down to where we see that bump there.
Okay, next question. So is shockwave for stress fracture similar to US bone wave therapy for fractures?
Shockwave, okay, so there's a different kind of shockwave machine out there now, which is a focus device. So again, if you look at that ice cream cone model that I had you picture, so the radial is the top of the ice cream cone. The focused is the bottom of the ice cream cone. So it's actually focused. And supposedly the focused works better on stress fractures than radial. I personally don't use it for radial, but I think some people do.
Okay, next question. Do you need to block the area or use anesthesia?
Never. I never had.
Okay, excellent. Moving on, what is your experience and success rate with plantar plate tears?
I've only used it probably about 3 times, and I would say 2 out of the 3, which is not to me like a large body. But people who had failed surgeries, if you have a failed surgery, I would try Shockwave. I would try Shockwave in a case like that. Also, kind of in the neighborhood that I didn't mention that works really, really well, better than anything I've ever used, are on sesamoiditis. So using Shockwave on the sesamoids works really, really well. I had a semi-elite runner, a guy who runs marathons under 250, and he got to 247. He was trying to break 250. He got to 247 really because I worked on his sesamoiditis with Shockwave, and he's been crediting me for using the Shockwave, and he's the manager at one of the Atlanta running shoe stores, and so he's been sending me a lot of people. Let's just say that. Next question.
Okay. If the first round of treatments are ineffective, number 1, is another round advisable? Number 2, how long should you wait before starting, if so?
I don't think there's a time limit. I think that, like, let's say somebody had 3 or 4 treatments and they felt completely well. And then they came back a month later and said, you know what, I'm getting a little bit here. So what I'll typically do, let's say it's plantar fasciitis, just to use that as a common example. I'll typically do 1 to 3 treatments. I've had probably about 3 or 4 people who are in that boat, and I typically just gave them 2 more treatments and they were completely well. So that's, I haven't had anyone go more than that though. Not yet.
Okay, excellent. Next question. I believe you addressed this in your presentation, but maybe just a little elaboration here. Is there any downtime? Can patients resume daily activities right away?
Daily activities, yes. There's no downtime whatsoever. Again, I don't believe in people running through pain. You know, pain is an indicator. It's a good thing. I'm kind of anti people, saying, all right, take some Advil and then go run because you'll feel better. No, pain is telling you something. So the answer is no.
Okay. Here's a question about your protocol. How many pulses do you give per treatment? I assume that varies depending.
Pretty standard. I've been, stuck on 3,400. I give 3,400 pulses.
Okay.
I haven't found the need to give more than that. And 3,400 seems to be the magic number.
Okay, this next question is sort of a follow-up to that. What settings are you using for different pathologies?
I use mostly 12 millijoules, and I rarely ever change my settings. I pretty much go 3,400 at 12 millijoules. And I will go up to, in terms of the shocks, you could adjust them. So I'll start off with about 70 or 80. And then for about the first 900 pulses out of the 3,400, then I'll pump it up to the max, which is 120. And then I'll leave it there till the end of the treatment. So again, you're talking 4 or 5 minutes.
Okay. The next question is, if the acknowledged mechanism of RSWT is the creation of an inflammatory response, why would we apply treatment the same day of expected musculoskeletal stress?
Because we're targeting a specific area. We are, you know, if you're having plantar fasciitis and we give you the shockwave, you're going to feel better with this analgesic effect right away. And I don't think you going out and running or playing your sport, you know, as long as you're not running through pain the entire time, is going to create a problem. Again, we're bringing blood to the area. It's going to promote the healing, you know, and if you stress yourself out, you know, with your exercise, it's not going to affect the treatment.
Okay, Dr. Spector, we have so many more questions to get to. You really have a lot of interest here from the attendees. We've gone over, okay, great, fantastic. That was going to be my question. We've gone over a little bit on the webinar, on the promised 30-minute webinar, but if you can stick with us, we'll get through a few more of these questions.
Sure.
Okay, are any of the treatments covered by insurance?
No. I mean, I don't know if other states, other jurisdictions, but in the state of Georgia, no. And I'm very happy having it as a cash basis type thing.
Okay, and again, very nice segue here to the next question. So how much do you charge per treatment, or do you charge per 3 to 5 visits?
I always do it by blocks. I'll charge $485 for the entire treatment, whether it takes 2 treatments, 3 treatments, 4 or 5. It's $485, and they pay that up front. And here's the other thing that I tell them is that when they come back, let's say it's a first visit and they're a new patient or even an established patient. So I tell them, look, you're going to pay your office visit and your x-rays, you know, however, whatever that is, if it's just a copay, you'll pay the $485 today. And when you come back on subsequent visits, if you're just coming back for shockwave, there are no copays. So it's an all-in charge. And patients really like that.
Okay, is there a maximum number of treatments that can be provided?
That's up to you as a provider. As I mentioned before, I sort of quote unquote advertise it as 3 to 5 treatments, but I even tell the patients, you know, if I have to do 6 or 7, I will. And I've never had to go over 7. So again, there are some people that charge $150 a treatment, and you know that can add up pretty quickly. Everyone does it differently, but that's just what I do, and I'm definitely on the low end at $485. But you know, as you mentioned, it was a year ago that I opened up this new practice. I left a group that I was with after 13 years and opened up a strictly sports medicine practice. And, you know, I kind of cut my price a little bit, but, you know, to attract more patients, and it's certainly working.
Excellent to hear. We just have so many questions here. I'm going to take maybe 3 more just so that the webinar doesn't run too long. Here's an interesting one. Have you ever used PRP with the ESWT?
No, but As you mentioned, conducting a study on injecting amniotic growth factors into the Achilles tendon. I also utilize that for severe cases for plantar fasciitis as well. And what I've done is when patients had to have amniotic injections and they failed for whatever reason, or they might have been 85% better, I'll actually do a couple of shock waves. And, believe it or not, I don't charge them for that. But again, what you charge is up to you. But I've done amniotic injections in combination with shockwave, and the results are excellent. As a matter of fact, I'm looking to put together a study utilizing both of those two things. But I just don't use PRP myself.
Okay. We have so many fantastic questions here. I regret that we can only get to a couple more of them. How many months do they need to have heel pain fasciitis before you suggest shockwave?
That's a great question. There is no timeline. So if they developed it yesterday, I would do it. If they've had it for 2 years, I would do the shockwave. It doesn't matter.
Okay. Fantastic. Last question here. What is the youngest patient you would treat with shockwave?
That's an excellent question. I just had a girl who's a gymnast who is 10 years old, and she was actually having Achilles pain, which is kind of sad that somebody that young is getting Achilles pain. But I treated her with shockwave. She had 3 treatments and she was totally better. So I don't think that there's an age limit, as far as I know.
Okay, thank you so much for that extended discussion, Dr. Spector. Thank you for your time.
Let me just throw in, I'm sorry to interrupt you, but really for other questions, please feel free to, send them my way, and I'd be more than happy to answer them for you.
Okay. We will put any attendees who have additional questions in contact with our Impulse for Podiatry and Sports Medicine expert, Paul. We'll put you in touch with him, and then he can put you in touch with Dr. Spector. And we will email answers to all of these questions that have come in that we don't have time for. A very impressive number of questions here. Thank you so much to all of the attendees. And again, Dr. Spector, thank you so much for your time and for that wonderful presentation tonight.
That was my pleasure.
And if anyone would like more information about the nPulse Pro, please visit Zimmer MedizinSystems website at www.zimmerusa.com. Be sure to visit the section of the website that's dedicated to providing information about radial shockwave therapy in podiatry. This can be accessed through the website's main navigation menu. Zimmer MedizinSystems also has an assortment of podiatry waiting room materials available for you to browse on the shopping site at shop.zimmerusa.com. And that concludes today's webinar. Thank you very much for attending. A recorded version of this webinar will be emailed to all attendees so that you may review this information at your convenience. Good night.